Hello, everyone. My name is Inemetet Sampson. I will be presenting today on the use of animal assisted therapy in the treatment of mental health disorders. What is animal assisted therapy? According to the International Association of Human Animal Interaction Organization, animal assisted therapy is defined as a therapy that involves animal assisted intervention with leverages to the human animal bond with an expectation of variety of outcomes as it relates to psychological, cognitive, physical, social, and emotional functioning or well being among individuals. What is a therapy animal? A therapy animals are defined as animals who help in the provision of comfort and emotional support to individuals who have physical or psychological distress. An example of individuals with such disorders will be someone that's suffering from anxiety and depression. An example of animals that are used in therapy are dogs, cat, horses, birds, and actually of recent I've actually seen a study done on insects. Literature synthesis was part of our annotative bibliography, pretty much looking at research and evidence as it applies to the topic of choice. So one of the research that I looked at was by Hagwood et al. This research was published in 2017. What the researchers did was they had different children with different mental disorders, and it was actually children and adolescents, and they put them in different groups and they used different animal assisted therapies that they developed, and they try to see what if they had a positive outcome based on what animal, and if there was um, anything that was different or similar in these groups. So pretty much in initially they found that the symptoms that the kids were displaying, for example, kids that had anxiety, the anxiety symptoms were a little bit more reduced. It wasn't as severe as when they started. They found that a lot of people liked dogs. In regards to like dogs, like using dogs were effective, especially I think that was the most common animal that was used in that research, and how the kids were developed a relationship with the dog. Some of them already had dogs, so it was easier for them to have this relationship with the dog, and obviously be more active and participate and be more active in what they were asked to do. So that was very interesting. Another research or article that I looked at was by Al Hijmuz and Arabia. That was in 2014, and it was published in 2014. And what these researchers did were they wanted to see the effectiveness of therapeutic horseback riding in children that had autism spectrum disorder. And what they did was they used an already existing standardized assessment to evaluate their outcome, to evaluate their intervention and see what outcomes they had. Uh, the what the researchers found out was that therapeutic horseback riding, okay, first of all, the children had to be diagnosed using the DSM 4 criteria at that time. And then also, the conclusion from the studies was that therapeutic horse riding was very effective in managing the different symptoms that these kids displayed when they initially presented for the study. They found out that their social interaction was improved. They found out that the ones that were a little bit more defined, um, the symptoms, those symptoms were improved, and the parents were very happy. The parents of the participants in the studies were very happy. So this was a very interesting article to read and to see what exactly or how exactly animal assisted therapy is used to treat this part of mental this type of mental illness. Another article we read was by Bush et al. This was published in 2016. What this authors did was they actually reviewed several studies that used animal assisted intervention in the treatment of ADHD. What they came to, the conclusion they came to was that if animal assisted therapy or intervention is effective in people that have autism, or individuals with autism, that it can also be applicable to ADHD. So this was also another of my favorite article in research to read, and I tried to compare studies. It seems like most of the studies are similar, so a lot of people are doing. It seems like a lot of researchers are going back and looking at how effective animal assisted therapy or interventions will be in the treatment of mental disorder, which is very, very prominent in our society today. Hardwick and Smelter also did an article on the role of animal assisted counseling in clinical settings and how it was perceived this time around by mental health practitioners. The study involved about 300 participants, and the findings were that about 91% of the almost 92% of the practitioners said they were more likely to use animal assisted counseling modality in their clinical settings. Just like I looking deeper, it was based on their personal experience with their clients. So they thought it was effective and they were willing to use it. Um, willing to use it more. So this was also an interesting study to read on, or article to read on. The other article I read had to do with was done by Eagling, and it was published in 2008. What this author did was he actually did a study on providers, psychiatric residents, nurses, and training. And what he did was just ask them based on their experiences if they felt like animal assisted therapy or intervention was effective in the treatment of psychiatric illness. And pretty much about 92% of the participants agreed that based on their personal experience, they thought it was effective. They thought it was effective in the treatment of psychiatric illnesses. So there are controversies about the use of animal-assisted therapy. I just picked out the two main ones that people had concerns about. One was allergy. They were worried, what if the provider had allergy to animals? What if the patient or the client had allergy to animals? What if, let me give an example. So outside of this, I also went further to read more about this, and I found that even in some campuses where people that have anxiety and they're college students, they were saying that some schools were going to the point of letting them bring kind of like a service dog, let them bring their animals if it was used for therapy reasons, to kind of help them calm down and listen in class. And there are controversies asking, saying that what if other students that have allergies are in the class with them? What if, just pretty much things like that. So some people are for it, some people are not for it, but that was one of the main controversy. The other one was animal abuse. Some people were worried about the use of the animals. How are these animals being used? Do they have to work for long hours? What is the role in terms of what is the animal physically doing? Is the animal just sitting, just running? Do these animals eat? Are they being maltreated? So those are the controversies that people have surrounding the use of animal assisted therapy. What are the implications of animal assisted therapy for practice? Over the years, the research that's been done has shown that animal assisted therapy is able to alleviate loneliness, stress, and health related problems, including those with long life disabilities. Also, there's been a great deal of attention that has been paid to human animal interactions and their psychological and physical benefits of this relationship for people that were studied. There's a lot of research studies coming out now saying that animal assisted therapy is beneficial in regards to emotional, physical, as well as social well-being. Another implication for practice will be to do another rigorous research that would show the huge amount of benefit that it's gained for just human interaction with animals in regards to mental health disorders. Um, this this studies should also have an impact in policy making, in the sense that, if the studies are coming out and saying that animal assisted therapy is beneficial, is this something that the American Psychological Association can adopt as a standard of practice? That's going to be the question there. Based on the research that I did and research so far that's available, even though animal assisted therapy is not as prominent as other therapy modalities, it's something that's oncoming. It's something that people are wanting to use, and there are articles and research studies out there that are in support of this. So I encourage everybody to read about it. And here are my references. Please feel free to look them up. If you want their article, I actually have these articles for free. If you want them, I can send them to you. I do believe that animal assisted therapy is uh, it's 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 kind of it's a positive therapy modality for our patients. I do think that in the near future, it should be incorporated as a standard of practice for patients that actually have severe mental health disorders, such as generalized anxiety, PTSD, um, schizophrenia, things like that, and see if this form of therapy would be beneficial in the long run. Thank you for listening, and I appreciate your time. I wish everybody good luck at this class and the next one. Thank you, and have a good day.